If a patient visits a clinician for the first time and the reason for their symptom is unclear, it's important to approach their case with more consideration at their next visit. Even if you weren't the clinician they saw previously, if they return and mention that this is their second visit for the same symptom, take the time to think more deeply about their situation. Mark, a 28-year-old web developer, had been experiencing intermittent back pain for a few weeks. He initially dismissed it, attributing it to his long hours hunched over his computer. However, the pain persisted, and Mark found himself increasingly distracted by it.
I started searching online for information about back pain, and my anxiety began to mount. Many websites linked back pain to serious conditions, even cancer. My mind raced as I imagined the worst possible scenarios.
Mark started to lose sleep, his appetite dwindled, and he found it difficult to concentrate on his work. The once innocuous back pain had transformed into a source of immense fear and worry. He finally decided to schedule an appointment with his doctor, but his mind was already consumed with dread.
My experience is not unique. Many people experience health anxiety, a condition characterized by excessive worry about one's health. This anxiety can manifest in various ways, from mild concern to debilitating fear. In my case, my back pain triggered a cascade of negative thoughts, emotions, and other physical symptoms, leading me down a path of escalating worry.
Health anxiety is a common phenomenon. It reflects our innate fear of illness and mortality. While a certain level of concern about our health is normal and even adaptive, excessive worry can be debilitating. Several factors can contribute to health anxiety. These include personal experiences with illness, family history of disease, exposure to medical information, especially online, and underlying psychological factors such as anxiety disorders or obsessive-compulsive disorder, OCD. In the age of information overload, access to vast amounts of medical information online can be a double-edged sword. While it can empower individuals to be more proactive about their health, it can also fuel anxiety by presenting worst-case scenarios as commonplace. This is especially true for individuals prone to anxiety, who may misinterpret information or fixate on rare and severe conditions. Primary care doctors often find themselves on the front lines of managing patients' health anxieties. Patients like Mark may present with other physical symptoms that are driven or exacerbated by underlying anxiety. The challenge for clinicians lies in acknowledging and addressing the patient's emotional distress, while also conducting a thorough medical evaluation. Dismissing a patient's concerns outright or attributing them solely to anxiety can be detrimental. It can erode trust and prevent patients from seeking help in the future. Instead, clinicians must adopt a compassionate and empathetic approach to consultation, validating the patient's feelings and taking the time to understand their perspective. This requires strong communication skills and the ability to explain complex medical information in a clear and reassuring manner. Primary care clinicians are trained to recognize disease patterns and often get a gut feeling when presented with a clinical history from a patient, prompting them to explore it further with or without investigations. However, they need to be adept at distinguishing between normal health concerns and signs of excessive anxiety, referring patients for specialized mental health care when necessary. Health anxiety exists on a spectrum. At one end, individuals may experience transient worries about their health that are easily alleviated by reassurance or simple medical tests.
For example, a headache might trigger a fleeting thought about brain tumors, but this worry quickly subsides. However, for others, health anxiety can be a chronic and debilitating condition. These individuals may experience persistent and intrusive thoughts about having a serious illness, despite medical reassurance to the contrary. This is a rare presentation of health anxiety in primary care, called hypochondriasis.
These patients may engage in excessive health-seeking behaviors, such as repeatedly consulting different doctors or undergoing unnecessary tests. In its most severe form, they focus on the presence of a disease, and health anxiety can significantly impair an individual's quality of life, affecting their work, relationships, and overall well-being. They may avoid social situations, limit their activities, and live in a constant state of fear and apprehension. Another form of health anxiety that is more common is called somatisation. Somatisation refers to the experience and reporting of physical symptoms that medical conditions cannot explain. Unlike hypochondriasis, somatization focuses less on specific illnesses and more on a broader presentation of unexplained symptoms. For example, chronic pain without physical findings, digestive issues such as bloating or nausea, neurological complaints like dizziness or numbness. The symptoms are the reality for these patients, even if objective medical evidence suggests otherwise. Some clinicians prefer to use the term functional illness when no known physical cause can be found for a physical symptom. A functional symptom means a function of the body is faulty. For example, there may be pain or diarrhea, but we don't know the cause. The cause may be due to mental factors, somatization, physical factors not yet discovered, or a combination of both. Nonetheless, these patients require assessment, clear empathetic communication, and support from the primary care team. Patients may repeatedly seek reassurance or demand diagnostic tests. The frustration of not finding a cure can strain the patient-clinician relationship. While the NHS is free at the point of care for the patient, unnecessary tests and referrals can burden healthcare systems. Additionally, on the clinician side, there is a risk of missing an underlying medical condition if symptoms are prematurely dismissed as psychological. That is why primary clinicians often take several months or years of interactions, investigations, and referrals to make a diagnosis of somatization or functional illness. If a patient visits a clinician for the first time and the reason for their symptom is unclear, it's important to approach their case with more consideration at their next visit. Even if you weren't the clinician they saw previously, if they return and mention that this is their second visit for the same symptom, take the time to think more deeply about their situation. Consider what might lie beneath the surface. Think about how you would feel if you were in a similar situation. What would you want for yourself? If you're a clinician, remember that rare cases can arise. Approach these situations with openness and empathy. When you connect with patients in meaningful ways, it can lead to lasting gratitude from them. Although these moments shouldn't be the sole focus of your work, they can add excitement to your career and motivate you to continue making a positive impact. General practitioners have various systems in place, including sharing narrative diagnoses with patients, referral systems, 2-week wait pathways, local formularies, algorithms, and NICE guidelines. These resources are available to clinicians to help understand people's problems and guide them toward better health. If you're suffering from health anxiety, speak to your primary care team for guidance on how to improve your health and well-being.